Hello friends, good evening. Corticobasal implants or the bicortical implants or the basal screws are the main assets when there is a atrophied or resorbed maxillar mandible, because you cannot place your traditional implants in the atrophied or resorbed maxillar mandible, because the design of the traditional conventional implants will not be good to place in the cortical bone. So that's why we go for the placement of the basal bone in the cortical bone. When there is an atrophy of the maxillar mandible, we are going to engage these cortical implants in the cortical plates, that is the second corticals and the third corticals, which is the bone which lies below the cancellous bone, both in the maxilla as well as in the mandible, so that we get good primary stability and anchorage. So if you can get the good primary stability and anchorage, our processes will be good, and it will have a key long life for the patients. So when the patient opts for the full mouth rehabilitation, so patient should think that which implant is suitable for them, whether it is the conventional implants or the long lasting basal implants. In conventional implant method, so there are very less methods available to engage the implant in the basal bone. Now the conventional implant also, they have come up with the two-piece lengthier implants. But in basal implantology, that is corticobasal implantology, we have different designs of the basal implants where we can easily engage in the cortical bone. Okay, so in full mouth cases, our main aim is to give good mastication and look for the patients, so that the patients will have good masticatory function and they live their life in a good way from further on. So that is what the motto of full mouth rehabilitation for geriatric patients. So main is the mastication and their good life in their old age. So these criteria should be met. So before starting the full mouth case with the corticobasal implants, so we have to evaluate the patient, the bone quality, type, and the length, all those things, with the help of CBCT or OPG. And also we send the patient for blood investigations. That includes a complete blood count or international normalized ratio INR, and as well as other tests like bleeding time, clotting time, and then PTT, prothrombin time. All those things should be evaluated before starting your surgical case. So during the placement, so main thing is what are the indications and the contraindications for the placement of basal implants. Basal implants can be placed in all the patients. When you can do the extraction for a patient, you can place the basal implant also in any case for that matter, unless if the patient is immunocompromised, or the patient is having radiation therapy or any other systemic conditions which will avoid these patients to go for basal implantology. So these are the contraindications to place the basal implants, and the indications will be, as you all know, we can place the basal implants in all kinds of bone and all age group above 18 to 20 years till the 75-80 years also we can place them, depending upon the health of the patients. So we have different types and designs of these corticobasal implants. In this corticobasal implantology, we have mainly three types. One is the basal cortical screws, that is the polished surface implants, and another one is the rough surface implants, we call it as a compressive implants, and the another one is the tuberopterygoid implants, TPA implants we have. That is wherein the threads will be both combined for both the polished surface as well as the rough surface. So we engage these tuberopterygoid implants in the pterygoid area and also in the fresh extraction sockets. And these cortical implants can be placed in the healed ridge or the healed socket, and as well as in the fresh extraction socket also we can place these cortical implants. Main thing what you need to know in this corticobasal implantology is, once the implants is placed, these implants has to be functionally loaded within 72 hours, that is within 3 days. Why it should be loaded within 3 days? Because during that period bone remodeling happens. So post operatively, after the placement of the implant, there will be bone remodeling for 3 days, that is the 72 hours. During that period the good bone is available. During this bone remodeling period, okay, so osteogenesis will occur, the bone will have good strength, and it will have a better adaptable capability with the implant surface. So bone remodeling happens within 72 hours. If we can functionally load the implant during these 72 hours, there will be good resistance to the functional load from the bone, and the adaptability of the implant with the bone surface will be good. So that's why we have to functionally load the implant within 72 hours, because that is the bone remodeling period, during which there will be bone remodeling happens. So new bone formation occurs, and the adaptation of the implant with the bone surface will be good, and during this period it will hold all the stresses so which applied from the functional loading. So this is what, and the remodeling will continue for 6 months. In some cases we splint the implants till the remodeling is over. That will take 4 to 6 months. So once this procedure is placement of the implant is over, so in the second day we do the impression technique, and followed by the zig trial as well as the metal trial we do. So after the metal trial and zig trial is over, we go for the processes. So when there is an inflammation from the gums, or when there is an inflammation, and if there is a chances of tissue lacerations, all those things, now we advise to go for the hybrid denture when there is an inflamed gum surface or the inflamed tissue is there. So that indicates shrinkage is going to happen. For in such cases, hybrid denture is very good. In the healed area, when the ridge is ready to go for the treatment, in such cases you can give PFM crown, or the zirconia crowns also can be given. So when you give the hybrid denture, you have to inform the patient's death. So later on your processes will be replaced by the acrylic surfaced or the veneered zirconia, or the PFM crown processes will be given. We have to inform that to the patient. So before starting the treatment, main other topic is apart from your other blood investigations and radiological examination, you have to take the consent from the patient. Whenever you do the implant treatment, you have to take the consent from the patient. There is a written consent from the patient and the relatives regarding what your treatment you are going to do, and mention all about the patient's systemic condition. If he is having diabetes, hypertension, or any heart related medications if he is taking, everything should be mentioned in the this one consent form, and you take the proper signature from the patient as well as from their relatives who is attending them. So this is the main things what you need to follow before starting the treatment. So after this the process is everything is over, functional loading is over, so the patient will be called for a reappointment after 15 days. So that is will be your appointment after the process is given. So 15 days after the placement of your processes, call the patient and do the checkup. So take an X-ray, take an OPG, check for any radiolucencies, or if there is any resorption bone, all those things you have to check. So after 15 days appointment, you will call the patient again in the 3 months period, 6 months period, and after 12 months period. So afterwards, after a 12 months period, if everything is fine, the patient need not to come again. He may visit after 1.5 years or 2 years once. So that is the thing how the process goes. So the main thing is in corticobasal implantology, this is the asset for atrophied jaws. The patient has to go for this corticobasal implantology if they really want the good teeth to bite on their food. So conventional methods will have less, the limitations regarding this atrophied jaws. So here in corticobasal implantology, we have different designs of BCS and compressive screws to place in the cortical bone, that is the second cortical bone. So on the modeling period only, we have to load the implants within 72 hours. That should be kept in mind, so that osseo adaptation will happen between the implant surface and the bone. So the conclusion part is that, so these basal implantology or the corticobasal implantology, there won't be any incision, there is no cut, not much of bleeding, less discomfort to the patient. So we'll keep the patient at ease and place the implants and give processes for them, so we can the patients can use such processes for lifetime. So for geriatric patient, for eyes patients, when they want to go for full mouth rehabilitation, please consult the doctor who is equipped and specialized in placing corticobasal implants. So you will have a hassle-free treatment period, and also you will have a good set of teeth in your mouth so that you can chew on those teeth for your lifetime. Thank you so much.